Good evening. Welcome to another Harmony Equine, Harmony Muzzle webinar. Sorry about the confusion on the dates. The dates went one way in one set of publicity and another way in another. So welcome, and if any of your friends did not get in, we will have the links to this available for you after the webinar. So let's get started. So what we want to do is to look at the whole vaccination issue and try to approach the whole thing from a sensible perspective. There's a lot of information, excuse me, a lot of misinformation, and a lot of fear and a lot of hype about the vaccine issue, and it is a big concern. And so what I want to do is just give you some food for thought as you navigate the landmine of every bit of information that's out there. So we'll just start with the basic idea is, what is a vaccine? Why do we give these things? It is a medicine that is given to stimulate the immune system, and the idea is that once that immune system is stimulated, that a portion of it is essentially marked with a tag so that it will recognize an invader. So the simple way to kind of think about it is think about it like an army. We know lots about armies these days. And each battalion in that army has a marker for each disease. So, for example, rabies, we might have a little battalion for rabies, or we might have a big battalion for rabies. But we have a battalion that knows what a rabies virus looks like. So if a rabies virus enters the horse's bloodstream, the immune system knows exactly what to do. If the vaccine has not been given, then the immune system does not necessarily know what to do. It might figure it out after a while, but it might be too late. You can also have the immune system respond from natural exposure, just like a vaccination. So something like a flu virus, lots of times the horses build up their own natural exposure and their own natural, essentially, vaccine. So a vaccination essentially does not have to be given as a drug. It can actually be the experience of the immune system and how it has learned to respond. We're going to be talking in this lecture about titers, and many people have heard of titers. So what really is it? All it is a blood test that measures that part of the immune system that responded. So we're measuring the size of the battalion. We can have a big battalion, well-funded, and we can have a poor or a small battalion. And some vaccines and some diseases produce a really strong immune system response, and some diseases produce quite a weak immune system response. And that's what we're going to measure with the titer. Now, the titer is not a perfect measure of the entire immune system, because we actually have an immune system that's very complex, and it doesn't just float around in the blood. We have the immune system at the cellular level all through our body, from the inside of our lungs to the inside of the gut to the inside of a joint. And so the titer is only a measure of what is floating around in the bloodstream. Unfortunately, or fortunately, blood is easy to get. That's the good part. But it doesn't tell us everything. We might have a low titer, but when the researchers are really looking at details that we can't look at, and they're in the lab, they can often measure a response that is at the cellular level that we can't and never will probably have a test for. So there's a lot of confusion, and a lot of people will say that they don't want it. A lot of the vets, particularly that have to draw the blood, say that they don't think that it's very useful, that they don't believe in it. There are some of the vets who will go ahead and draw it, but they charge a fortune because they really don't want you to do it. They'd rather you just go ahead and give the shot. So there's a lot of education that has to be done. And when we send you the link to the to this webinar and the slides for it, there will be a link in there for a study that we'll talk about later with rabies titers. So just know that the titer is a good indication. It's what we have, and it can be a very useful thing. And it gives us a number in case we need to give it to a boarding barn or a shipping agent or somebody who requires to know that this horse has been protected against a disease. So what is the big issue here? Why is this controversial? Well, vaccines are supposed to prevent disease, and they sometimes do that. Vaccines can also cause disease, and they can certainly exacerbate chronic problems that the horse already has. Because what we're doing when we give a vaccine is we are sticking a compound in the body saying to the immune system, you must respond. So if we keep doing that year after year after year, sometimes that immune system can't respond, or it's tired of responding, or it's so weak that the vaccine actually makes it weaker. And many people have been told, at any rate, and we certainly learned this in immunology, that you give a vaccine and for a couple of weeks, the immune system actually may be a bit suppressed. It may be a bit lower, which is why you don't vaccinate before you ship a horse from New York to Florida. You do it at least 10 days, 2 weeks, or even a month before you leave. Because if you vaccinate them, throw them on the trailer, and take them off at the other end, they're probably going to have pneumonia or a serious illness because their immune system was down. So the other issue is that vaccinations are required by a lot of boarding stables. A lot of veterinarians set up a plan, and if you're going to board at a particular stable, you have to comply. Sometimes the stables will allow the titers, and that's where they can be very useful because we can check the titer every year if we have to and show that the horse maintains its titer and its vaccination status. And I have certainly done titers on horses year after year for exactly that reason. And because of that, we have a lot of data that says that these titers do stay consistently present. Some more issues that we have. The normal medicine, good care of your horse, the veterinarians approve of giving it once a year or twice a year, especially in the high performance horses. Everybody thinks that twice a year is really the best thing to do. Sometimes backyard horses, they'll just say you only need to do it once a year. But because the official position is kind of that vaccines are not harmful, we can do them more, and you will be doing a better job. So good old America, and the more is better. And that's actually prevalent all over the world. The AAEP, the Equine Practitioners Association, advises certain vaccines should be given to every horse. And so in other vaccines, they sort of recommend that the vet should tailor it to the horse's requirements. And we're going to talk a lot about that a little bit later. There are some state laws, particularly in New England, and state laws can change, and I don't keep up with any except my own state. But I do know that in New England, there are some laws that require a rabies vaccination every year. And that is difficult to get around. It's fine if you're in your backyard, but if it's a state law, Veterinarians are required to do it, and if you're going to take your horse anywhere, you have to comply, and you have to be able to show that they have had their shot. There's no research in horses that says that the vaccine only lasts a year. The current research in dogs, cats, and humans is that if they have what's called a protective titer, which we'll talk about in a minute, that they're good to go, or that they are protected. Nobody's done the research in horses, so we're kind of stuck in some cases. So what would be good medicine or good use of a vaccine? We would only give the vaccine that we had chosen to give at the time of the year that's most appropriate for that disease. For a disease that is present in your part of the country or your part of the state. Some of these diseases are not prevalent in large portions of this country. And we would only give what that individual horse needs. So there could be 10 horses on the property, and you could have 10 different approaches to what would be the best for this individual horse. So that's what I consider practicing good medicine, whether you're looking Western or holistic, thinking about what you're actually going to do. What I would call bad medicine is it's January, nobody's busy, so let's just throw the book at everything and vaccinate. And then we're kind of bored, it's September, let's do it again. Oh, there might be a mosquito in February, so we'd better vaccinate in October, and we're going to have a frost 2 weeks later. So we have to think about our diseases. The holistic approach to vaccination, there certainly are people who will say, all vaccines are bad, you shouldn't vaccinate anything ever. And I think the rational approach or the sensible approach is to realize that that vaccinations may not be all that bad in certain situations, that every animal is an individual and every farm is an individual as to what is required. And there are many horses that don't need hardly anything or any vaccinations. But we want to look at the situation, and we want to do what is correct for that particular horse. So if you're going to think about the whole vaccination thing, here are some of the main questions to ask. Is the disease life-threatening to the animal or to me? Is the disease present in my area? And if you're not sure, the best question to ask your veterinarian is not, should I vaccinate my horse? Because you're going to get the answer of course, yes. But instead ask, how many cases of Potomac horse fever has your practice treated in the last year? How many influenza cases have they treated? And you can even survey a number of practices in the area and find out what the prevalence of the disease is in your immediate area. With the internet these days, we will often have one case of a disease in a distant part of the state, and you would think that there were 1,000 cases, because by the time it circulates through the internet, it has grown from one single isolated case to a total panic. So is the disease present in my area? Now, if you are in the north and you go south in the winter, you have to ask the question, is the disease present in the south where I'm going? Or do I commonly compete on the coastal areas even though I live in the mountains? So you can have many questions to ask depending on where you go with your horse. Then you want to know, is the vaccine actually effective for what we're doing? And then, do you actually need it to enhance the health and safety of your horse? A lot of times the answer to that will be no. And then, is there a titer available instead? Could I just check my vaccine status of my horse and not have to do any vaccinations at all? So I'm going to run through all of our common vaccines that are given and ask some of these questions. So, and in doing this, you get to think about the disease itself and how that applies to your horse. So flu and rhino are both non-life-threatening. Now, the vaccine that is available for rhino does not protect against the neurologic form of rhino, which is the form that can be fatal. So the vaccine does not protect against it, even though people will run around and say, well, maybe it will help. Well, actually, the research shows the opposite, is that horses heavily vaccinated for rhino, and some get vaccinated every 3 months. Then you have to say, why are they being vaccinated every 3 months? Maybe it's because the vaccine doesn't work very well. So we have that to add to our list here. So horses that are heavily vaccinated for rhino often actually suffer worse if they get the neurologic disease than horses that have not been vaccinated or over-vaccinated against rhino. And there is some data that has been published. It's not often talked about a lot, but it is official data. So it's a non-life-threatening disease. It's an annoyance kind of disease. You miss a horse show if your horse gets flu. Well, you miss the same horse show if you get the flu. So it is not a life-threatening disease. It's very treatable. We can treat it very well holistically. Conventionally, it's a virus. They usually give you some antibiotics, even though antibiotics don't kill a virus. But the bottom line is you miss some time and then you go back onto your regular schedule. So it's not a big deal. The vaccines are not very effective. They're often repeated more than once a year because they are considered to be not that effective. When we draw blood, the titers are not usually very high, but if we draw the blood every year, we'll see that they stay about the same every year. And our adult horses are often immune to rhino, and sometimes if their immune system is suppressed, they will catch the flu, but many times we can go to a horse show and be exposed to the flu, and not every horse is going to get it. So flu and rhino are both vaccines that are really not very useful. And even from taking a titer standpoint, it's sort of like we don't really have to bother. It's not going to be a life-threatening disease. We can always take blood. You can always take titers if you personally want to know what that titer is. You're not going to hurt your horse at all. But it's just one of those that's not very necessary. With rabies, we're going to go to the opposite end of the spectrum with vaccines. It is a life-threatening disease, both to the horse and to the owner. And rabies in horses can be kind of scary because more often than not, it looks like a case of colic that then goes bad. And so usually there's quite a few people that get exposed to it because you're trying to treat a case of colic. And you get saliva into your cuts and scrapes on your hands, and people are sticking hands in horses' mouths and noses. So rabies is a very serious disease. It occurs frequently in some places. In other places, it's extremely rare. So even though it's a serious disease where it occurs, in some parts of the country and some parts of the world, it is totally not a concern. Here is where this vaccine works. It gives excellent protection, and the titers last for years and years, and it produces extremely high titers. The rabies study that was published, that you'll get a link to, was published by Kansas State. It was a 10-year-long study working with dogs. And what they found is that the titers lasted, and the dogs that were out of date responded just as well as dogs that were in date for their rabies vaccine. So they have come up with a statement that says if a dog, cat, and it also happens to be true for people, has a 0.5, that's the measurement, 0.5 number or higher, that they are protected against being bitten by a rabid animal. The test only goes up to 14. So it goes from 0 to 14, with 0.5 being protective. Many horses are in the 7 to 14 range, and many horses are actually over 14, which means that we have come back repeatedly and stimulated that immune system battalion to the point where it's overfunded, and then it's kind of getting bored, and then it starts to do destructive things to the rest of the body. So some of our immune system issues that we see in horses can be traced back to way too many rabies vaccines. So for horses that are not required to have them legally, 1 or 2 shots in a lifetime is very often good. And the most common statement that I write on my rabies titer sheets is dead and buried before you have to recheck this. So it's a titer, if you're in a rabies area, it's a titer that is worth doing because it is a disease that can be very serious. But you only may need 1 vaccine in a lifetime, maybe 2. Many horses that you may have purchased have already been vaccinated a bunch of times and never need a vaccine again. Potomac horse fever is kind of in the middle. It is a disease that certainly can be life-threatening. It occurs in some areas and not others. I only live an hour away from the Potomac River, and down by the Potomac River, we still have cases despite regular vaccination. Out where I am, there are occasional cases, but for the most part, we don't see a lot. So you have to look at your specific area. The vaccine is also not great. Maybe it's depending on the study that you see, 65 to 80 or 75% effective. And some people say that they feel that the horses are less sick if they've had their vaccine. The titers that the vaccine produces are not very high, but if you take them every year, they do tend to be consistent. So if I'm looking at horses in high-risk areas, we will check the titers. And if there are cases nearby, then we will go ahead and vaccinate if we have low titers. If there are no cases around and the titers aren't high, we'll keep our ears to the social media, not getting too panicky, but listen and see, and if there's anything happening in the area, then we may want to reconsider our vaccination status. Tetanus is a life-threatening disease. Horses are actually quite susceptible to tetanus compared to some other animals. The vaccine, we used to have a lab that did titers commercially. And so I had about 10 years of collecting tetanus titers. And we never saw big high numbers, but they remained the same year after year when we rechecked the same horse. So, and in humans, they remain for a long time. It's usually 10 years or something before they recommend you get another tetanus shot. We do not have currently a lab that does titer tests. I have gotten access to a German test, so people that are in my local area can get it. And there may be a few other holistic vets around the country that also have gotten this particular test, but it's not generally commercially available. The tetanus vaccine, fortunately, seems to be the least problematic. So if we don't have a titer, we might only need to do the shot once every 2 to 3 to 5 years. And we also know that if the horse gets a wound, there is a tetanus antitoxin type of shot that can be given at the immediate time of a wound that could be serious. So we have some options there in how we approach tetanus vaccines. Strangles is non-life-threatening despite the hype. There are certainly cases that are poorly managed that can become life-threatening, but for the most part, Strangles is non-life-threatening, but it is extremely contagious, and it is a very messy disease. The horses get quite sick, and it can be expensive to treat. So it may become an important disease in certain areas. It can be quite common, but in most areas, it's not that common. So again, you have to know your area. This vaccine seems to be really tough on the horses, and they do an intranasal vaccine as well, and I'm not sure that that's a whole lot better. I think some of the head shakers begin after they've had some of these intranasal vaccines, and it may be a more accurate way to vaccinate, but I don't necessarily, I try to avoid this vaccine as much as possible. The titers for Strangles are useful, and it produces a good moderate titer. And so if it's a concern in your area, you may never have vaccinated your horse for Strangles, but there may be enough of the bug of it around in the soil that he actually has given himself a natural vaccine. Our Eastern and Western encephalitis is a life-threatening disease. It is regional. Like there's no Western encephalitis in the East, but the titer tests are actually done now as Western and Eastern together. The shots are always Western and Eastern together. There's not even that much Western encephalitis out in the West. In the East, we do have it in the coastal areas. We do have it in the South. And it's mosquito transmitted. So it's only going to be transmitted during those summer months, except for you poor folks that live in the South, where you can have mosquito transmission year-round. The vaccine does seem to work. Most of the cases, the clinical cases that we see, have known to have not been vaccinated in many years. It's a tough vaccine on horses, and it's one that I try to avoid if I can. The titers, again, don't make big high numbers like the rabies, but year after year they are consistent. And if I'm in an area where this disease is a problem in the coastal areas, we might check the titer every year or every 2 years until we can draw a nice straight line and know that the horse has a good titer. West Nile virus is a newer disease. It can be life-threatening. It is not always. And it is also very regional. So you need to look at what's common in your area. When it first came to the United States, it kind of went through the entire country and has now sort of found its niche where it likes to be. This is one of those that is recommended for all horses to get. When you're talking to your veterinarians, there's often a lot of pressure to get this shot because of the recommendation. There are a lot of places in this country where there is no West Nile. And there are some pockets of West Nile that are not coastal, that are inland. So you just have to know your area. We do get good titers to it, so you can check those. And if you've got high levels, you are probably in pretty good shape. So if we think about timing, if we're going to do vaccines, the insect-borne diseases are going to generally start in June and July, unless you're in the South, and then they may start in May. They don't usually, there's usually a gap time in which the disease is not very prevalent. It's sort of like you have to have enough mosquitoes around to carry the disease. Potomac horse fever, it may be mayflies, it may be snails. There's a variety of potential vectors, but generally you're talking about early to midsummer until the frost, until the mosquitoes go away. So if you decide that you're going to vaccinate for one of these insect-borne diseases, do it once in May, because you'll have your protection for the peak time of the year, and you don't have to be giving shots twice a year. And you don't have to be giving a shot in February when you're up in New England, because you're not going to see a mosquito until June or July. So I'm going to mention here, we've got some things called Knossos, which those of you who've been doing some homeopathy with your animals may have heard of. And if you've been doing some internet research, you've probably run across them. And a Knossos is a homeopathic preparation from a sick animal. And it takes the fluid, like a Strangles. Knossos would be made from the snot that comes out of the nose. And a West Nile nosode would be made from the virus or from the blood of a horse that's actually disease. These are things that actually can be useful. The research on them is not as easy to do as it is for a vaccine because we're not producing a titer as such. What we're doing is working with a homeopathic preparation, which is an energetic preparation, and we are triggering the body's immune system to help protect it, to help build up that that battalion, but we don't have a measurable battalion. The best research on the nosodes has been done in places like rescue dog kennels, and quite a few of the holistic veterinarians working with these rescue places, as well as some large kennels, have taken the incidence of things like parvovirus and things like that from 60, 70, 80% of the dogs that come through down to things like 5%, 8%. So very significant changes. But we can't sit here and say, if I give this nosode, your animal will be protected, the way that they try to say that if I give this vaccine, your horse will be protected. And that's not always true. But it can be nosodes can be very useful if the disease is in your neighborhood. And a lot of times, especially we'll take Strangles as an example, we take Strangles, and Strangles has come home from a horse show on one of the horses, and they come down and they're sick. You actually don't want to go through and vaccinate the whole rest of the herd for the exact reason we talked about earlier, in that we have, after the vaccine, usually the immune system goes down while it's busy responding. And so if you give a vaccine when the disease is present, a lot of times the animals actually get a lot sicker. So this is a perfect time for a nosode to step in, because you can give that nosode and you're actually going to be helping the horse's body heal or not get the disease. We do not want to substitute nosodes for everything. And there was a time in which even the homeopathic vets thought it would be just a really good idea to substitute and give West Nile and give tetanus and give this, that, and the other thing, all in the form of nosodes. But really, each dose of nosode we give is a treatment. So we should save that for when we need it and not just do it to replace a vaccine. And then when if we have to give a vaccination, or we have to look at treating horses that have had adverse reactions to vaccines, homeopathy is a great way of treating the immune system, supporting the immune system, and trying to prevent some of the side effects that we might see. And the side effects from vaccines can be significant, and they can be long-lasting. So if your horse's body has a bad reaction to every vaccine, it's probably telling you it really should not be vaccinated. And potentially, if your horse has a tough reaction to vaccines, you may be able to get a veterinarian to sign off and say this horse is too sick at this time to get a vaccine, or his immune system is not strong enough, and you can delay it. So with homeopathy, I usually use the remedy called Leadum, which is for toxic puncture wounds, and a vaccine can be considered a toxic puncture wound. So I will give some Leadum in a 30C potency or a 200C immediately after the vaccine, if at all possible, and then maybe a dose or two for the next couple of days. Lots of people talk about the homeopathic remedy Thuja, or Thuja occidentalis, and that is also commonly used immediately after a vaccine to try and prevent some of the side effects, and that one can be useful as well. I usually find that I'm using the Thuja more for the long-term symptoms that come up in the weeks and months after a vaccination. And I use a lot of constitutional homeopathy where I really take the case and figure out what happened when we have these horses that are clinically ill after vaccination, and or at least that the vaccines are part of what has affected their immune system. And so that's the sort of thing you want to work with a good homeopath. And I do telephone consults to help people sort through what is the most specific remedy for your horse to recover from the vaccine issues. So that's kind of a different way of looking at vaccination, and there is so much to really learn about it and so little time to share it on a webinar. But we will be able to take some questions and then send you some links for later on. Thank you all for coming, and I'll look for the questions. This usually produces quite a few questions. Is anybody out there? If you all are out there, you can also try and type it into the chat question if the question and answer thing doesn't seem to be seeing. Okay, here come some questions. It seems that many vaccinations come in multiples. Can you only get one? Yes, you can get single vaccines. The thinking is more is better and convenient rather than what's best for the immune system. You can request single vaccines through your veterinarian if your veterinarian's doing the vaccination. Some of them will carry them, some of them do not. You can also go to the online pharmacies and order single vaccines and take charge of your vaccination program yourself. And if you're trying to take charge of your vaccination program and you're getting a little bit of pushback, you can certainly make a decision to take the responsibility for the vaccinations and just let your vets know that you're taking over. And do your Coggins test and keep your relationships good and not challenge their thought process, because they have been trained that vaccinations are good and harmless. And if you're listening to this talk, you probably have slightly different ideas. Can you talk a little bit about young horses and how often they should be vaccinated? With the young horses, in general, once they have they're grown up to be old enough, usually by 6 months old, they are no longer being affected by the mother's immunity. If you vaccinate 2-month-old horses, 3-month-old horses, the mother's immunity often will take over and actually cancel out the vaccine, because that battalion is working hard and trying to protect its little baby immune system. And as the foal matures, then the immune system stands on its own, and you can actually give a series of vaccinations. Again, thinking about what you really need in your area. And you can go through and do an initial series of what's important in your area, and then come back a year or two later and check the titers and see what you have. Sometimes with the young horses, you'll want to do a vaccine series the second year, and many of those horses will then be fine for life. What I try to do when I interpret the titers, when they're, as you're going to 2 years, 3 years, 4 years, to try and interpret the titers, I look to see how high the titer is, and then I decide, should we recheck that titer next year because it's not very high, or is that a really nice high titer and we should wait 2 or 3 years to recheck it? So you can have a choice as to how often you recheck it. But I generally like to ask what's important in my area, and then go ahead and vaccinate for those things. And then hopefully that's all we have to do for the rest of their life. The next question is there a vaccination for Lyme? Well, there is a dog vaccination for Lyme. There is no legal horse vaccination for Lyme, or no licensed horse vaccination. There are a lot of people using the Lyme dog vaccination, and the Lyme disease is a very complex spirochete, a very complex, very smart bug. And I think that it's very difficult to make a true vaccine against something that's that smart. The EPM vaccine kind of went away for the same reason. It was around for quite a few years, and then I think they kind of realized that it's too complex of an organism to make a simple vaccine for. I also find that horses that have Lyme disease tend to do very poorly when they get vaccinated, and I try to avoid it whenever I can. What do you suggest to keep the immune system strong when doing long-distance trailering across the country? The big thing, anytime you're trailering any long distances, whether it's across the country or going north to south for the warm winter, or even just going to a competition that's 4 to 6 to 8 hours away, is starting ahead of the trip. Is you can increase your vitamin C for your horses, just like you would do for yourself. You can, I use some adaptogenic herbs called APF Pro, which I keep on my website, because I find that really, the adaptogenic herbs really help the immune system cope with the stress. You don't get the high cortisol. And I use probiotics. I use Probi from Advanced Biological Concepts. I use Equilite's Pre-Pro. And that will support the immune system, support the horse, keep that cortisol under control. And I'll also use things like Rescue Remedy if I need to. Any other questions? Looks like that is all for tonight. Thank you all for coming, and look for our next webinar.